Hello everyone, welcome to PHTV4. I'm Sue Jankowski. Today we have our spotlight on Medicare, and we have Diane Aducey here with us today. Diane, thanks for coming in.
Oh, it's a pleasure.
Yes.
Thank you.
Diane is from Aducey Insurance Services, and we have Diane come in periodically about this time of year because she is really an insurance expert, gives us a lot of information on Medicare, and it's that time of year where you can make the changes and enter Medicare or whatever. To me, she's like a guru about Medicare.
Thank you.
Yeah. So, Diane, I guess first of all, we're going to talk a little bit about the kind of the basics of Medicare.
Sure.
So that people who are unaware, or like maybe they're going to be going into Medicare next year, and it's always good to know these things ahead of time.
You're right. You're right. So, okay, great, Sue. So we'll talk a little bit about the basics. Medicare A, B, C, and D. Medicare A and B are actually, I think, the most important, right? Because Medicare Part A covers hospital stays, and that can be expensive. And once we're no longer getting coverage from an employer and we're 65 or over, we really need to have Medicare Part A. And Medicare Part A is premium free for most people because all the years that we are paying into the Medicare system out of Medicare taxes, out of our paychecks, we're helping pay for that Medicare Part A premium. So as long as we have 40 calendar quarters or 10 years paid into the Medicare Part A system, we get Medicare Part A premium free when we need it, okay, when we're eligible for it. And typically eligibility is at age 65 for most people. And then Medicare Part B, that also comes from the federal government, and that's also very important and something we probably use more when we're on Medicare, because Medicare Part B covers doctor's fees, whether it's the surgeon in the hospital or a simple office visit or, routine tests, preventive, MRIs, ambulance, outpatient surgery, emergency rooms visits, that sort of thing. That's what Medicare Part B is all about, and that we do pay a premium for.
Okay.
And on Friday, November 8th, oh my gosh, I'm sorry, my phone just went off. I apologize. On Friday, November 8th, Medicare did release the new Medicare Part B premium for 2025, and that Medicare Part B premium will be $185 per month per person. So when a person is approaching age 65, let's just say I was going to be 65, say in March, then I know that if I want to sign up for Medicare A and B, I can do that up to 3 months before my 65th birthday month, the month of my birthday, or up to 3 months after. So for many people, they want to sign up, let's see, that would be December, January, February. I could sign up December 1st for a March 1st effective date.
Okay.
Because even if my birthday was March 31st when I was turning 65, my Medicare coverage will become effective the first of the month of March.
The first of, so you really do want to look into it prior to your birthday. You really want to
Absolutely.
get it. Okay.
Yeah. Occasionally I have a few people that will say, oh, I was in denial. And they don't do it right away.
It's really happening.
Yes. But actually, Medicare coverage is very good coverage, so it's not a bad thing. It's just like people just think of Medicare as being older. That's all.
Well, and it is.
And it is,
But
right.
that's okay. It's a good thing to be older.
Yes. So Medicare A and B really form the foundation of our medical care when we're 65 or older and no longer have our employer coverage. And it is very good coverage, although it doesn't cover everything. It leaves us with deductibles and co-pays and co-insurance, which is a benefit percentage to pay for. So what can we do? We can do a few things. We could purchase a Medicare supplement. These are also known as Medigap plans, and the Medicare supplement can help us with these costs to limit our exposure or our liability. So we can buy a Medicare supplement plan from a multitude of insurance companies, I think like 45 insurance companies in Illinois, but it is helpful for us as consumers to know that if I'm buying a Medicare supplement, and they are also identified by letters of the alphabet, A, B, C, D, E, F, and G, and there's a few more besides that, but G is really the one that's the most comprehensive plan that a person can buy if they're just turning 65 and going on Medicare now. So it is good to know that the Medicare supplements are standardized throughout the industry. So if you are buying a Medicare supplement plan G, or maybe it's an N, or in some cases it may be an F as in Frank, that whoever is selling that plan, the benefits are the same with everybody. The premiums can be different, reputations are different, claims paying history may be different, but the benefits are identical. So that's very helpful. So if you and I both have Plan G and we have it from different insurance companies, we both know we have the same benefits.
Okay, the only difference would be our cost.
Right,
And,
right.
and whether we prefer that company or not.
Exactly,
Yeah, okay.
exactly. Reputation and, you know, preference, of course, matters a lot, and price,
Yeah,
right?
of course.
So anyway, so Medicare A and B, pretty basic, and then we have a Medicare supplement. And then some people will say, well, what about drug coverage, right? So that's when we have Medicare Part D that when I get through these basics, we'll talk a little bit more about.
Okay.
But for right now, it's good to know that Medicare Part D, as in David, is the prescription drug program. And that's been around since 2006. And if we have Medicare A and B and we buy a Medicare supplement, that does not cover prescription drugs. We need to buy a Medicare Part D plan in order to do so.
Okay, that's really good to know because I think you feel like you have all this coverage. That should take care of that as well.
Right.
But no.
Right, especially because when we're working and have employer coverage, we usually have one card.
Right,
Right?
yes.
And that one card covers everything. But when you're 65 and on Medicare, you've got your red, white, and blue Medicare card. You may have a Medicare supplement card, and then you'd have a prescription drug card too.
You do,
Right?
yes.
So it's just like, oh boy, but it's very manageable. And, you know.
Yes. And good to know that you do really need Part D as well.
Right, exactly. And then there is something called Medicare Part C, and Medicare Part C is something that you can get as an option to traditional Medicare A and B and a Medicare supplement and a drug plan. Because with original Medicare A and B, that I was first talking about, we can use any Medicare approved provider in the country. Referrals are not necessary. Prior authorization for procedures is not necessary. So there's a difference. With traditional Medicare, that's one way, any Medicare approved provider, no necessary network, freedom to choose among anybody in the country that accepts Medicare. And then there's the Medicare Advantage plans that can sound very exciting and you know, oftentimes the premium is zero, although it's good to know that if you have a Medicare Advantage plan, you still have to have Medicare Part B as in boy. Right?
Okay.
So you still must apply for Medicare A and B. Once I have it, I can say, oh, I want to try a Medicare Advantage plan. And there must be 50 of them available,
Oh, wow.
at least in Cook County. So with a Medicare Advantage plan, then you would not be using your original Medicare coverage. You would be saying, I'm going to go to this Medicare Advantage plan, and you would want to make sure that your doctors and hospitals and skilled nursing facilities and anybody that you want to use are in that network. And then that would be one thing that you would look at. You would also look at how are your drugs covered on that Medicare Advantage plan, because most Medicare Advantage plans include a prescription drug component. So they have Medicare Part D built in. So I could look at this Medicare Advantage plan and say, okay, my doctors, the hospitals, everybody that I want to use is in network. My prescriptions may be covered very well by them. And then I'd also want to look at what are my expenses going to be. Because the premium for many Medicare Advantage plans can be zero, however, $0. However, I'm going to have costs for my services when I receive them. So my costs on a Medicare Advantage plan is really determined by which services I have and how often I have them. Because you know, if I'm paying a $20 copayment to see a specialist, and I'm also paying maybe $500 a day when I go into the hospital, or I have a $200 a day copayment for skilled nursing, I need to be aware of this, right? So some of them are copays, which is a fixed dollar amount that I can say, oh, I'll pay $20. If something says 20%, then I'm going to pay 20% of the cost, right? So many of the Medicare Advantage plans, as far as like chemotherapy and radiation are concerned, then usually your cost is 20%. And you may say, well, oh my gosh, 20% of how much? Well, all of the Medicare Advantage plans do have a maximum out-of-pocket limit for the person. So if I enroll in a Medicare Advantage plan, that's another thing I want to look at. Are my doctors included? Are my prescriptions covered? What are my copays? what is my maximum out-of-pocket limit? It may be $2,500, it may be $6,700 for the year. What does that mean? That means that if all of my co-pays and co-insurances for medical expenses add up to this maximum out-of-pocket, let's say it was $2,500, then my maximum out-of-pocket is met for the year for medical services, and any other covered medical service I have for that calendar year, I would receive at zero cost. So that's good. So, but if it's $6,700, I'm like, that's a lot of money. So is $2,500, really. So a lot of people will look at it as, what is my maximum liability when I'm looking at a Medicare Advantage plan versus a Medicare supplement. So a Medicare supplement is I don't want to say, that was a poor word. Other plans are dependable too. Predictable. Okay, predictable. I know that when I buy a Medicare supplement plan, and let's say I purchase Plan G, and if I purchase Plan G, I know Plan G is going to cover my Part A deductibles and co-payments and co-insurance, and my Part B co-insurance. However, it won't cover my Part B deductible. So that's what I'm responsible for. So I'm responsible for the premium that I pay for my Medicare supplement Plan G and the deductible. Now that Part B deductible this year is $240, and they did release the Part B deductible information for next year, and that's going to be $257. So I could add up my premium, what I'm going to pay for my Plan G. I could include that $257, right? Because I'm probably going to incur that cost. And then I would say, what's that maximum versus the potential on a Medicare Advantage plan? And that's one way to look at it, right? I mean, what is my maximum liability this way or that way? And then a person also has to weigh on a Medicare supplement with original Medicare A and B. Do they want to be able to choose their own physician and skilled nursing facility, et cetera, as long as they're accepting Medicare? Or are they going to be okay with using the network? Or if they go out of network, they'll have to pay more, or in some cases, all. It just depends on the Medicare Advantage plan itself. So usually most people know what they want, right? Because a lot of people will say, well, I really don't want an insurance company because a Medicare Advantage plan comes to me through an insurance company, right? So the Medicare, so this insurance company, they need to manage your care under a Medicare Advantage plan because they really want to make a profit at the end of the day.
Yes.
And a lot of people say, well, how do they offer this plan at $0? Well, if you enroll in a Medicare Advantage plan, then Medicare will say, you don't want original Medicare right now, you want a Medicare Advantage plan, and Medicare pays the insurance company that you have chosen to take care of you.
I see.
Right? They have a set dollar amount, and that insurance company now has a job to do, right? They want to offer you coverage and manage your care and give you care, but still, obviously, do that within those limits and maybe make a profit.
Okay. So I guess some people may feel, but there's nothing wrong with me. I have really good health, and I'm going to go with that.
Yes.
But we can't predict the future.
Oh, if we only could.
So I think you have to take into account that, things can go awry at times, and you want to pick the best way for you to go forward with the insurance.
Right,
Yeah.
and you're right. I have some people that say, well, I'm going to go on a Medicare Advantage plan now, but then later on I'm going to switch to a Medicare supplement. And that's fine, but they must be aware that when they first go on a Medicare Advantage plan, they have a 12-month trial right under Medicare. And Medicare says, hey, if this is not your cup of tea with the Medicare Advantage plan, you can go back to original Medicare, of course, at certain times throughout the year. And you can also go back to a Medicare supplement plan of your choice during that 12-month trial right. Beyond that, most insurance companies will say, oh, you're leaving a Medicare Advantage plan, and we want to know, well, they will ask you medical questions to see if you qualify for their plan. And there's a chance that you won't, or a chance that you would be charged more, or a chance that you'd be approved. But that would be something that a person has to take into consideration as
Okay.
well.
Well, there's a lot to think about with all this.
There is. It seems like a lot.
It really does. at a time of your life where you don't want to think about that stuff.
Right.
But you know, I always do well with my pencil and paper and writing everything down and
Pros
kind of
and
weighing.
cons.
Yeah, exactly. And they have a decision to make about that.
Right,
Okay.
and actually, a married couple, one person could go one way and another person could go the other.
Yeah.
That's fine. They don't have to both have the same plan, so they can make separate choices. And so I don't forget to say this later, when you're if you are purchasing a Medicare supplement plan, then when you choose your Medicare prescription drug plan, you do not have to choose the same company. There is no advantage or disadvantage to going with the same company. So what's key about the Part D plans, and we'll talk about that in a moment, is going with the plan that covers your drugs in the most cost-effective manner. That's key.
That is key. Do you have to, if you do a Medicare Advantage plan and it includes that, the drug part of it, then you're not really looking to see if you're, because it's just covering whatever it covers. So you're not looking up the drugs to make sure that they cover you.
No, you do. You do need to. So
you
the
do.
Medicare Advantage plan has the Medicare prescription drug plan built into it.
Right.
In most of them. So if it's built in there, you also need to check on those drugs to make sure they're covered well too. And you may say, well, how do you do all this? Because I had just mentioned there's 50 plans and there's 15 drug plans for next year, which is low actually compared to years past. There's a wonderful software on Medicare.gov, Medicare.gov. It's the drug plan finder. And you can use that for a Medicare Part D plan or Medicare Advantage plan. So if I have a Medicare number, I can go to Medicare.gov and create an account. Very easy, right? And let's say I've been on it for 6 months and I've had some prescriptions filled. My prescriptions, as long as I use the drug plan under Medicare to fill those prescriptions, they're like making a little list there for me,
Oh,
right?
nice.
Yeah.
Yeah.
So I can go in there, sign in, see recently added drugs or drugs that I've had, and I can edit the list. And I suggest that everybody on Medicare do this every single year. All right? Because between October 15th and December 7th, you can change your drug plan or your Medicare Advantage plan if you have one. And you really need to be aware of this. And I do send out emails to my clients to remind them, but I know that they don't all read them because, it's not super exciting, right? And
But it's super important.
it is super important. And some people have read them, and I do appreciate it. But between October 15th and December 7th, that's when you can change your drug plan. And this year, next year, I should say, 2025, is a big year for Medicare Part D. Because 2 years ago, when the Inflation Reduction Act was passed in 2022, one of the issues they wanted to address was the out-of-pocket drug costs that Medicare beneficiaries have on Medicare Part D or Medicare Advantage plans for their drug costs. So what they did was they limited the Medicare beneficiaries' maximum out-of-pocket for covered drugs next year to $2,000. And $2,000 I know is a lot of money, but I have clients that are spending much more than $2,000 this year on covered drugs. So next year it will be a safety net for them.
It really will.
Right.
Yeah.
So next year there's no donut hole or coverage gap. The deductible for Medicare Part D plans will be anywhere from $0 to $590. And then the person will pay the correct co-payment or co-insurance depending which drug their tier is in. And then if they should reach $2,000 in out-of-pocket covered drug costs, because that does not include the premium, it's just what they pay for their covered drugs, then they will pay $0 for the remainder of the year for their covered drugs. So that's pretty big news, and it's exciting news. But it brought a lot of changes to Medicare Part D, because now the insurance companies are responsible for more of the cost of the drugs than they have been in the past.
Okay.
So some of these plans, and this is very important, that's why people should look at their plan this year and how it will change for next year. One of the plans that was listed under $10 this year, a Medicare Part D plan, has quintupled in cost for next year. So
Wow.
if someone was paying less than $10 and now they're going to be paying closer to $50, they need to know.
They
right?
do need to know. Yeah, and so the cost is kind of balancing out a little bit, for if the insurance company is going to charge you more money for that plan, then they're still even with money, I guess, is what I'm trying to say.
Right, of course, yeah, because I always think in my next life I'll come back as an actuary, because I think it would just be so exciting to be moving dollars around, because you still have to make money at the end of the day.
You do,
but
yeah.
Yeah, so do the drug plans increase their premium, as not only that company did, but a few other companies doubled their premium?
Yeah.
And so every year, people are supposed to receive by September 30th of each year the annual notice of change for the following year from their Medicare Advantage plans or prescription drug plans. Some people had told me they didn't receive theirs, and that's possible, or maybe they received an email and we have too much email, maybe they didn't see it.
Yeah.
So I'm asking you now, please look at your drug plan. And if you want to look at them also in this book, because we all on
we all
Medicare
got, yeah.
received this book this year, page 127 lists the drug plans for next year. And some drug plans are not available any longer because they went from 21 to 15. And so not only did the premiums change, but some plans maybe said we kept the same premium, but we're not covering the same drugs as we did last year. Or they may say, this drug that may have been on a lower cost tier, like maybe 3, is now on 5, or maybe it's on 4. Or another way, or, maybe they added a deductible in. The maximum deductible set by Medicare is $590. And the premiums, the drugs they cover, the tiers, the co-pays, everything could have changed. So the best thing a person can do is to go to medicare.gov, and if you don't have an account now, create one. All you need is your Medicare number. It's very easy.
Okay.
And like I said, if you've been taking prescription drugs, your drugs should be in there. If you've been using a Medicare Part D plan, if you're new to it, you can input the prescriptions. It's very simple to do. And if you don't have a Medicare number yet, because maybe you're that person turning 65 in March or even January, and you don't have the number yet, you can just go in. You don't have to create an account. Just go in.
Look.
Yeah. And no one else is looking at this except for you. It's not like this information is being distributed to anybody.
Okay, good.
It's just for you. So, and maybe you were taking 3 different prescriptions, and so you could input those prescriptions, input your zip code, say, oh yeah, I would go to Walgreens, I would go to CVS, Mariano's, or Roscoe, put as many as 5 pharmacies in, and then I could say, okay, now what? Well, if I'm new to Medicare, I would say see plans available. And the first plan they show is going to be the most cost-effective plan for me. They take into account the deductible, the premium, your co-pays, everything. And they will show a dollar amount there, and that is what your dollar amount will be for the following year based on those drugs.
That seems really helpful. Like,
Super.
Really, just you sit there for a while, and then if they're figuring out all the monies that you will be spending, that's really great.
It's wonderful. And then, like I mentioned, there's 15 plans, because the one that's the most cost effective will be listed first, second most cost effective second, et cetera, all the way down to 15. So what a person should do is they could say, oh, okay, they might say, oh, this is great, but they want to know more. There's a little blue rectangle that says plan details. Click it. And if you click it, then it'll show you more about that drug plan. And anytime you see a plus sign somewhere, click that too, because it just keeps opening. It expands from, like, a little snapshot to, sometimes maybe 10 pages of information.
Wow.
And you don't have to print it all, but you can, save it as a PDF or just view it. But you should be aware that some drugs, some plans have a situation where there's a deductible, say of $590, but maybe it only applies to drugs on tiers 3, 4, or 5. And tiers 1 or 2, maybe you just have low co-payments, and the deductible doesn't apply. Or maybe another plan doesn't have a deductible at all, right? And some plans, they have like a $0 premium plan, and is that always going to be the most cost effective? No, because they might not cover all of your drugs, or your drug costs may be too high. So this wonderful software program, I can't say enough about it. If you have a computer, you can use it. You can go to the library and use it, because like I said, it's not like you have to say your name or anything. You're just putting in some prescriptions. If you don't have a computer, you probably have a friend relative, someone, and most people are very happy to help with this because a lot of us like, oh, look at this is a really cool software program, right? And they want to use it. So I suggest that you do. And the other part of this, though, is that if you are currently on Medicare and you sign into your account, and it's going to show me, oh, this is the plan I have right now, and this is what it will be next year. And then that will show first. So what you really want to do is look at the next one, because the first one that if I'm in a plan now, it's going to show as first. But I want to look below that, because that will show me the most cost-effective plan. If it's the same plan I'm in, great. I don't need to do anything at all, right? I don't need to re-enroll or anything. But if there's a big difference in the prices, I probably want to change.
And you can do that right in this program.
Absolutely. There's a little green box that says enroll, and once I've made my decision, I can click enroll, and then I will answer some questions, review it, and then submit it. And if something should change, like today's what, November 12th, right? Yes. So today's November 12th. And what if something changes for me, November 30th, and I take a different prescription? I can go back and change it again during open enrollment. I can change that drug plan again as many times as I want. Not like I really want to do it, but I could.
But just in case, you
up
could,
until
yeah.
December 7th. And the last one they receive for open enrollment will be the one that goes into effect on January 1st.
And then that's effective for the next year.
Yes.
At which time you can change it again if you need to.
Exactly, next fall. So I'm just asking everybody, please look at your drug plans. You may say, oh, this is boring. It's not boring at all. If you think that you could be saving a potential, just say $500 or $600, that's not boring.
No, that's a good thing.
That's a good thing, right. And if you wait until December 8th, you can't change it.
Oh, yeah, so you got to do it right now.
Right now.
Get that change in or not. Maybe you are satisfied and it turns out where everything's just great.
Exactly.
But if not, it behooves you to go on. When you have such an easy way to do it, go right on the computer. And yes, there's a lot of people who help you. I know not everybody wants to be on the computer or can be on it, but find a friend or one of your kids or something to help you.
Yeah, and again, if you want to, you could call your insurance company, right? Whatever XYZ insurance company, say, here are my prescriptions. Can you tell me which one of your plans will cover this plan the most cost effectively? And this morning, I think, I said there's 15 plans. That's not 15 insurance companies. It's basically 5 insurance companies that are offering more than one plan. I'm pretty sure it's 5. Maybe I forgot, but I have 5 or 7 at the most. But so call them and ask them to help you with it. Or you could call Medicare and say, hey, I've looked at this plan. I think this is right for me. Will you help me? Medicare, 1-800-MEDICARE can help. And then SHIP. We always talk about SHIP. Their phone number is 800-252-8966. Or you could go to www.shiphelp.org. And maybe we can put that on the screen later or something.
Yeah.
But people are available to help. Yes, your agents can help or your broker, but they're trying to help a lot of people. And so you might want to take matters into your own hands. And so, just to make sure that you're in the most cost-effective plan for your needs.
Okay. Well, thank you for bringing that all up. I think it's really important that you do that and you don't look back and think, I should have, because now I'm in a fix. I'm in trouble. So you want to do it right now. And, like Diane was saying, there's so many outlets for help that you can do yourself. Calling a phone number is not difficult either.
No, calling a phone number, calling Medicare, and they have, I think, more people. Of course, they hire more people at the insurance companies during this time of year because it's so busy.
Yeah, great. Yeah. Diane, thank you so much for bringing this information to us.
Well, thank you.
I'm just always astounded at all of the great information that Diane has right up, rolls right off, and she can tell us all about it. So thank you so much for coming in today.
Thank you.
So go out there and make sure you got the right Medicare plan for you and your husband or partner or whatever, your wife, and just make sure you're satisfied. That's all, I guess, is the message we want to send to you. Thanks for watching us, and we'll see you next time on another Spotlight Show.
Thank you.
Thanks. Bye now.